welcome to Medical Dialogues. I'm Roshnida. Let's look at today's top news. Doctor's body found with hands-feet tied at home in Posh, Delhi area. The tragic murder of Dr. Yogesh Chandrapal in Jangpura, Delhi is indeed shocking. As the police suggest, this appears to be a case involving multiple perpetrators potentially driven by the motive of robbery. It's especially alarming considering this occurred in what described as a relatively quiet neighborhood. The fact that Dr. Paul and his wife, both dedicated medical professionals, have been targeted adds another layer of tragedy to the situation. This incident not only raises concerns about safety in residential areas but also underscores the vulnerability of individuals even in their own homes. 3-4 people may be involved in the murder and robbery, the police said. Dr. Paul's wife Neena is also a doctor in Delhi Government Hospital. The doctor couple pet dogs were found locked in another room, the police said. Further investigations are still going on. The National Institute of Nutrition has released updated dietary guidelines for Indians reflecting new scientific findings, lifestyle changes, common diseases and dietary habits. A significant update in these guidelines is the endorsement of earthen cookware as the safest option for cooking. According to NIN, earthen pots are not only eco-friendly but also conducive to nutritious cooking with less oil. The guidelines also address the use of various types of cookware. It advises against storing acidic foods in containers made from aluminium, iron, unlined brass or copper due to safety concerns. While stainless steel is generally safe as it does not leach harmful substances, non-stick pans pose the risk if used above 170 degrees Celsius or if their coating is damaged. If you're also a doctor or nurse who's working night shift, it's important to know that recent research highlights potential health risks associated with this schedule. According to a study published in the Journal of Proteome Research, just 3 days of night shift work can disrupt the body's normal protein rhythms, which play a crucial role in regulating blood sugar, energy, and inflammation. This disruption can elevate the risk of chronic conditions such as diabetes and obesity. The research, a collaboration between Washington State University and the Pacific Northwest National Laboratory, involved monitoring volunteers on simulated night or day shifts. By keeping these volunteers awake for 24 hours under controlled conditions post-shift, the researchers were able to study the body's internal rhythms free from external disturbances. Their findings showed significant alterations in the proteins that manage glucose, indicating that night shift schedules can lead to a misalignment in insulin production and glucose regulation. Although this misalignment might temporarily manage altered blood sugar levels, it could have serious long-term health implications. These results underline the importance of early interventions to prevent metabolic disorders in individuals who work night shifts, like in hospitals, PPOs, which could also help lower their increased risk of heart disease and stroke. While further research is needed, these primary findings stress the need to align work schedules more closely with our natural biological rhythms to enhance health and well-being. Kerala is on high alert as West Nile Virus cases reported from Kozhikode, Thrissur and Malappuram. West Nile Virus or WNV, a concerning mosquito-borne arbovirus and part of the Japanese encephalitis antigenic complex, has been reported in Kerala. With 12 confirmed and 4 suspected cases emerging in just the last week, the state has been placed on high alert. The virus, primarily transmitted through mosquito bites, has been identified in the districts of Malappuram, Kozhikode and Thrissur. Health Minister Veena George, speaking to media, stated that although a recent death in Palakakar is suspected to be linked to this virus, confirmation is pending test results from the National Institute of Virology in Pune. The virus is known to be spread by mosquitoes after they bite infected birds, typically migratory ones. In response to the outbreak, the Kerala government has ramped up preparations to contain the virus spread and treat the infected promptly. Local authorities have been instructed to intensify mosquito control efforts to eliminate the breeding grounds of the Culex mosquito, the primary vector of WNV. Health experts emphasize that while the virus can lead to severe neurological conditions like encephalitis and meningitis, most infected individuals do not show symptoms. There are no specific vaccines or treatments for WNV. Medical care is supportive. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.